Welcome to Let's Talk Space Medicine. I'm your host, Kyle Anderson. For your listening entertainment, I gather my other medically inclined space nerd friends to talk all things space medicine. With our powers combined, we hope to explore and entertain the medical questions that stand between us and the stars. And for today's show, we have Captain Joseph Ziebelman. He is a fourth year psych resident at the University of Texas Health Science Center in San Antonio and Brooke Army Medical Center, and he served as a captain in the United States Air Force Medical Corps. He originally went to University of South Central Florida for his medical degree and went onwards for a master's degree in mental health counseling at the University of Florida. And he has some incredibly interesting interests, including space medicine, military medicine, veteran psychiatry, and everything under the sun related to mental health and military and space medicine interests. And so I'm so happy to have him on the show to kind of give some of those angles and some of the perspectives on psychiatry as it relates to space medicine and some of the military background that I know a lot of people I've talked to are really interested in. So, Joseph, thanks so much for coming on the show. How are you doing? Where are you calling in from?
Hey Kyle, so I'm doing great. A little busy since getting back from the aerospace medicine clerkship last month, which was a blast. I'm calling in from San Antonio, good old San Antonio.
Yep. So we originally met each other at the 2025 April Johnson Space Center Aerospace Medicine Clerkship. Joseph seemed like a cool enough guy to talk to a little bit more about what he's done. So I know a little bit about him, but I was curious to have him on the show to learn a little bit more. So where I like to start is, when did you first hear about space medicine and where did the journey start?
Yeah, so that's a great question for me. And I joked around in the clerkship as I introduced myself, and some people made fun of it. But my actual love of space started when I was young, when I went to space camp. Back in Florida at Cape Canaveral. So they used to have one in Florida and they used to have one in California, and now they just have one at the U.S. Space and Rocket Center in Huntsville, Alabama. And I joke around, but during space camp and later I went to Aviation Challenge. Not a lot of people know about Aviation Challenge, which is only at the Huntsville location, but it's kind of the abused stepbrother of space camp, I like to call it. That space camp gets all the funding and all the accolades, and they even had an Olsen twins go to space camp type thing. But Aviation Challenge kind of flies under the radar, and it's more about fighter planes. And you teach the kids survive, escape, resist, and evade techniques, how to build a fire, living in the woods. There's even flight simulators for airplanes, so it's really cool experience. I did space camp one summer, and then I did aviation challenge one summer as a kid. So that kind of sparked my interest. And I remember someone asking me what I wanted to do when I grew up, and I said astronaut. And he said, "All right, that's fitting." So then later in college, I became a camp counselor at space camp for one summer, and that was good to get back to my roots and be able to give back and teach kids about all about space flight and all the physics about Bernoulli's principle. And there's even a G machine. You get to practice some G's. It only goes up to like 3.2 G's. And get back in the fighter simulators and challenge the kids and do 1 versus 15, and they try and get me in the flight simulators. And then yeah, so it kind of always carried with me. And then I went into more of the mental health counseling route. I got a master's in mental health counseling, worked for a little bit. Um, Tried out the PhD route. I know you got your PhD, but I did it for a year and I was like, nah, this is not for me. I did not want to do all this
That's
research.
smart.
It was just not for me. I respect everyone doing it because it's important, and I'll do a little bit of research here and there. We had to do a research poster for the clerkship, and you got to do research in residency in medical school. But I just didn't saw the future and didn't want to be full time research doing research. So I got out of the PhD program, did a post back in Atlanta at Agnes Scott. It's a all women's college actually, but it has a co-ed grads program for post back for people who are trying to get back to med school or PA school or nurse practitioner prereq courses that you can take, and you can do it all in a year, which was appealing to me. And it was in the South. Um, yeah, so that was a good time. I lived in DeKalb County. I think that's close to you at
Yep.
Emory. And then yeah, so did that. Got accepted to University of Central Florida, but I was a little older by that time, so I wanted to get school paid for and have my own salary. So I did the HPSP scholarship in med school. So they paid for all 4 years, and they give you a little bit of a salary. And the reason I chose Air Force, even though to my dad's consternation, he's Navy, my granddad's Navy, my brother's a Marine. I chose Air Force because of my love of space and my love of, airplanes and fighter pilots and all that stuff, and being able to serve and work with them. I thought that would be an awesome job. So then I graduated med school. I did a medicine year first because I thought I was going to do flight med for a little while. During my intern year, I was like, all right, I'm able to do this. I was 31 or 32 at the time. I was like, let me just get residency done with. So I applied to psychiatry residency, and now I'm here at San Antonio finishing up my psychiatry residency program. I wanted to get residency done so that way, while I was still young and could handle the call shifts and all the, extra stuff that comes with residency. So I'm in residency now. I just found out that I will be PCSing, which is permanent change of station to Langley Air Force Base in Virginia. Uh, and so I'm looking forward to working there because it's the number one ACC, which is Air Combat Command, in the continental U.S. It's a F-22 base. A lot of big wigs there. There's a lot of generals, and there's a lot of eyes on you. So you got to be a liaison for mental health aspects for fighter pilots and whatnot, and the crew and everyone in the Air Force really. And then after I owe 4 years, so I'm hoping they'll let me do 2 years and then 2 years as a flight doc, so I can apply to the Air Force residency in aerospace medicine, which is in Wright Pat, and then maybe I can go on to work at NASA or continue my service in the Air Force or you know wherever that may come. That's a long time from now, so got a lot of options, and I'm sure it'll come clear my path as I tread it.
Yeah, I mean, it sounds like there's lots of doors opening for you given kind of your background and some of the experiences that you are able to do given your residency training. So one thing that I didn't quite get was when you were able to connect the dots between space and medicine. Like, when did you figure out you could take care of pilots and astronauts? When did that happen?
That's a great question. I think so. I was at University of Central Florida in Orlando, and there was a lot of military doctors there. There was a couple military doctors, and one of them was Air Force, and he was talking about how he did flight med for a little while, and so that kind of connected it for me, in a career I could do. And then I looked at it more, and I saw that there was this aerospace medicine clerkship, and I tried my hardest to get into it. However, the year I graduated med school was 2021, so this I was trying in 2020, and what happened in 2020 is right at the height of COVID. So my school unfortunately would not let me go to any outside away rotation, including aerospace medicine at Johnson Space Center. Anything outside the city, we weren't allowed to leave unless it was an audition rotation in the specialty you were trying to match in. So I was always in the back of my mind. I joined AMSA. Um, and just kept going through residency. Applied, one time to the aerospace medicine clerkship, did not get it. So, and then this year I got it. So I was able to join and have an awesome time. It was honestly some of the best learning and some of the best time in my training that I could say.
Yeah, I could definitely reflect some of that. Just meeting, a ton of people like yourself, super interesting backgrounds, super motivated and passionate about, space exploration and medicine. Is being in a room full of all those different people, it's like magnetizing, there's something in the air. And really happy that you were able to do the clerkship and meeting you and meeting everyone was just so much fun. And yeah, I'm I'm glad to hear that you had a great experience. And is there anything about the clerkship that you can speak to? I know that there's when you start the clerkship, you do sign some paperwork about not talking about certain things. So please to say, hey,
Yeah.
I'd rather not talk about it. But I am curious to hear what you did, if you can talk about it.
Yeah, sure. First, I want to say like my impression was just like in awe. Like you're at NASA, you're like you have these PhDs and very smart people, that some of the smartest people in the world talking to you about issues or problems involved in space travel and what they're trying to do to solve it. It's just like you're just in awe. Like I was like I feel like I'm a humble, psychiatry minded person. And psychiatry to me is pretty simple, maybe harder for other people, but talking about decompression sickness, SANS, space associated neuroocular syndrome, things like that is, and then what they're trying to do and work on it and how they're diagnosing it. It's just you're just in awe. It's kind of like it's so like amazing, like the dichotomy of like all these smart people talking about all these issues and medical problems going on in space flight, and then like you could come back to the real world, and then you have to be a doctor for like a community. Like I take call at a community hospital, and you have to still um explain things in a way that uh maybe more people can understand. It's kind of interesting, the dichotomy. It's kind of like reminds me of when I was a mental health counselor. I worked in the halls, in the residence halls, and there would be, issues between roommates, and they'd be fighting over, the temperature, or she doesn't go to bed early enough, or he doesn't, wash his dishes, things like that. And then I'd be a counselor in in the community, and it'd be like a homeless person who, had to fight off someone with an axe who was trying to steal, his cart of stuff. It's
Hmm.
kind of interesting, the dynamics, the dichotomy, that you have to kind of adapt yourself to a lot of times in medicine. So it was just another area where you have to adapt to all these smart people talking about interesting things and very complicated problems and how they're going about solving it.
Yeah, that kind of, makes me wonder like your experience on the connection between terrestrial medicine or everyday medicine and space medicine. So, a lot of people like to draw the line between the two and say, hey, people, lose bone density and then they get osteoporosis, or hey, people get, changes to muscle atrophy, or they get changes to, they get they get SANS, and they have changes to their vision, and there's usually some kind of earth analog that they hang their hat on and say, hey, because I've been doing all this residency training, I think it's really applicable to what happens to our astronauts. So I'm kind of curious, like, what are some of the things that you kind of think about as the connection, some of the diseases or the presentations that you see in that general population that applies to the astronaut corps?
Yeah, definitely. I think I drew the most links when I was during the course of the rotation between what I was learning about in astronauts and their behavioral health and their mental health, and what our airmen and soldiers and corpsmen and things like that get deployed experience, because a lot of the astronauts experience a lot of mental health, even though they don't necessarily talk about it. There's an interesting article on the diaries of the astronauts, and they don't explicitly say that they're having mental health issues, but they kind of imply it by saying the teamwork dynamics are not as great, or the stress level is high. There's too much to do. They kind of beat around the bush that maybe they're worried, or they're depressed, or they feel lonely, or things like that, or they're not working together, not connecting well. Um, of course, most of the time they are doing well, but I kind of took that and associated with a lot of the people I see in the military that have been deployed, and experience a lot of the same things: teamwork dynamics, loneliness, isolation, being away from your family, having a video conference back in, doing morale booster activities. Psychiatrists are now on a deployment. Air Force psychiatrists are now on a 6 month deployment cycle to Kuwait, and the people who have gotten back from that, the attendings that talked to me, have talked to a lot about how a lot of their job was, keeping the morale up, and doing kind of workshops on what the soldiers could use to increase their morale. And it was interesting to see a lot of the same dynamics with the astronauts. Like they said, the astronauts will have movie night. They have special conferences with celebrities, and when you're deployed, a lot of like comedians will come and talk and make jokes with you and things like that, and visit you, sometimes politicians and things like that. So it's kind of interesting dynamic, and it may be due to NASA's history of being more associated with military. The first astronauts were military pilots, and so maybe it's associated with that. But it is heartwarming to see that they're taking such um, emphasis on astronauts' mental health as well.
Yeah, I think so today is May 4th, so it's Star Wars Day. I think they're
Yep.
on the ISS, they're watching one of the Star Wars movies. So that is
Awesome.
that was super nice to see, but I'd actually never heard of like a morale boosting like intervention. Is that something that's like known in terrestrial medicine, or like is that just a military medicine type of thing?
Um, I would say that it is known in terrestrial medicine, in regular medicine, as we call it. It isn't so much emphasized too much in psychiatry, but when I was in mental health counseling, it was more emphasized in psychology. The psychologists kind of work on those kind of things, and it's definitely something um, really emphasized in the military because they know how hard it is on people. They know how hard it is on soldiers, on their family. They know that you're constantly maybe being asked to move, maybe being asked to come in late, work nights. I just talked with a guy who just got off nights, and he has a young kid at home, and he was talking about how hard it is. Um, but the units usually do some types of morale things, similar to kind of the civilian world, where they'll say you don't have to wear your uniform on Fridays and you can wear your favorite sports team or something like that. Just little things to like help out and boost your morale, and it allows people to kind of get to know each other better, other than from a work standpoint.
Hmm. Yeah, I mean, those little things make a big difference, kind of breaks things up. Yeah, I mean, I think, like, as you brought up, a lot of military medicine and aerospace medicine are kind of hand in hand. Do you have any other, like, experiences or any other kind of perspectives on um, any other stories that you have on military medicine and kind of bring people in into what it may look like on a day-to-day basis? A lot of the people that I've talked to in the past are usually non-military, and I'm a non-military person myself. So just kind of painting that picture and what does it mean to be an Air Force psychiatrist?
Yeah, so we joke in the Air Force that in the Air Force psychiatry that it's half psychiatry and half occupational medicine. So a lot of it is determining fit for duty. And a lot of it's putting people on profiles. Just because you have we don't want people to not come to uh, mental health or behavioral health. We don't want people not to come to our clinic. And the military has gotten to kind of a good place where they're more accepting of behavioral health than in the past. It still has some ways to go. But a lot of my job is determining fit for duty and then treating also psychiatric disorders. Um, so a lot of it's putting people on profiles, talking to command, doing command directed evaluations, which is kind of where command sees something wrong with someone, but they don't see something wrong with themselves. So command kind of tells them they need to go to behavioral health, and then helping command kind of and being a liaison for command and the soldier to determine how to get them best back to performing their mission. Um, let's see. Yeah, so a lot of my job is kind of being a good liaison for behavioral health and kind of explaining things to command. Um, a lot of times we get people at the beginning of their career, at the end of their career, and around post deployment time are the main hot button times for behavioral health. Beginning of the career, a lot of times it's people who are at boot camp because San Antonio has the basic military training BMT for enlisted airmen. So we'll get them when they, maybe they're not used to the order and kind of people yelling at them and having to make their bed and keep everything clean because they just came off, their mom taking care of them, mom and dad, and they're not used to, and they're playing video games all day, and now they join the Air Force for something to do in their life. So we get a lot of them coming from that, and a lot of times we can kind of do some therapy. Usually, there's not a lot of medication management in that area. A lot of times, we'll get them out if there's they express some suicidal thoughts, um, and then they're not fit for the military because you don't want someone that is not able to handle the training aspect, and then you deploy them and then they get stressed out there when they can't really get easily um, sent home or things like that. Then we get people at the end of their career, and so that's a lot of times people kind of hide their mental health issues, and then they start to realize a lot of their stuff was stressful. They went through a lot of traumatizing times. Like I'll give you an example. I had someone who his daughter died of suicide, and so helping him through that. And then of course, being military, there's a lot of machismo and suck it up mentality, and you can only do that for so long before it starts to spill over in your real life. And so, counseling him through that, getting him to, where he's a stable place, able to function, and able to, still be a good husband and father to the rest of his kids is really rewarding in the military sense. And I think that more links to behavioral medicine because in the astronaut corps, there's a lot, there's still a lot of tough it out mentality. There's still a lot of suck it up. But you still want to be there and help out the astronauts and let them, especially if they've, gone through something traumatic or things, are hard in their real life. Especially, when they're on in space, away from everything and, they could have a family member who died, or they could have other, hard incidents on their families, and then helping them through that. That's why it was actually encouraging to see that NASA's doing these private psychological conferences with astronauts once a week while they're on board the ISS. It kind of shows their emphasis on mental health and how important it is for them to take care of their astronauts, not only physically, but also mentally.
Yeah, I mean, I think a lot of conversation goes into all of that from the NASA flight docs. They talk a lot about how to deliver news when they're on mission, how to, what type of events trigger what types of communications while they're away from home. And I think it takes up just an enormous amount of time to like sit with all of those eventualities and really kind of have like an informed process. Hey, what happens if one of your family members is, is severely hurt, or what happens, should we tell you? Will this, do you want to know? Do you only want to know these many details, or the number of permutations and how you can handle that seems enormous and seems very relatable. I think, when you hear news and, everyone has complicated lives, filled with ups and downs. And whenever we've had one of those ups, we feel a certain way and it affects our performance. And then when we have those downs as well, like reflecting on that, they definitely change how you perform in these different things. And I think an enormous amount of time goes into the psychiatric issues, and um, being prophylactic and trying to really sit with difficult conversations, as evidenced by that once a week type of conference, as well as all of the pre-flight planning that goes into that.
Yeah, definitely. I think you nailed it on the head when you said being prophylactic. That's the name of the game in space medicine. Trying to anticipate anything that may come and being prepared for it. Like you said, talking to them about when would you want to know if a loved one unfortunately passed away? Do you want to know when you're on a spacewalk? Do you want to know right before you're about to go out? Or do you want to know when you're back and you've had a chance to decompress, literally and mentally, um and and know that something may have happened to one of your family members. Because I can't talk much about it, but there have been incidents in the past. So NASA has learned there's the public incident, of behavioral health issues of the astronaut that kind of had some marital relation issues and drove to from Houston to Florida, wearing the space diaper, and confronted her husband or ex-husband about a woman he was seeing. So there has been behavioral health issues in the past, and that was a very public black eye on NASA, and so they're trying to, their hardest to avoid that kind of situation in the future, especially if something happens during a mission.
Yeah, I mean, I'm sure there's a lot more to learn behind the scenes that prying eyes can't quite or would go beyond a barrier for everyone's privacy considerations. That would be would be very interesting, but obviously damaging to these individuals. I guess one of the things that I was also an aerospace medicine clerk last year, and my eyes were just opened on the things I can talk about, like how much more is being done, like everything that you think is being thought of, they're trying to think of. So
Yeah,
I'm kind
yeah.
of curious on your perspective, like from when you went in versus when you left, were you like, oh my God, they've thought of everything, or do you feel like, hey, there's a couple areas I really feel like we could be pushing or anything like that?
Yeah, both. The answer is both because they have thought of a lot of things, but they're still formulating a lot of things for future deep space missions like to Mars. I was lucky enough to have Dr. Williams, a psychologist, as my mentor for the month and working on my poster presentation with him. But talking with him about some of the issues they're facing in regards to behavioral health, and deep space travel because and I was working with Dr. Gary Bevan, a psychiatrist at NASA, and Dr. Picano, also a psychologist. And some of the research shows that behavioral health is the second biggest issue for deep space travel. The first being space radiation. So just imagine, a mission to Mars, and it's probably going to be around 3 years long. It takes 8 months to get there. Maybe you spend, I don't know how long, maybe a year or so on Mars, and then you come back for another 8 months. And so generally it's going to be 2 to 3 years long. And in that time, all your food has to stay good for 3 years, up to 3 years, and all your medications. You're going to be eating the same food over and over again. Like the ISS gets a new shipment of food, every month or so on average. But on a trip to Mars, you're not going to get that. You're just going to eating the same, kind of freeze-dried meals and MRE type meals over and over. And what does that do to your morale? You're also going to be in an enclosed space with the same people for up to 3 years. Um, so what is that like, and how do the team dynamics work? Your communications are going to be delayed, by 40, 45 minutes when you're at Mars. So what is that going to look like? Is it going to be, just like exploring in the old days where, you don't have that much communication, when, we were exploring the new world, and they had to rely on themselves mainly. Um, so there's a lot of challenges, behavioral health, and the main way that NASA is currently getting around that is through selection. Um, and selection. 6 to 8 thousand people apply, and about 10 people get the astronaut selection every couple years. So there can be picky, but as space travel expands, you can't be as picky, and you're gonna have, and if you want to make it accessible to all people, you're gonna have to really expand your parameters, and maybe you have to compromise some behavioral health issues. If you're gonna get, a lot of people go into space or try and form a colony on the moon or on Mars, eventually. That's probably a long ways away, but um, these are the different challenges that they're facing, and they're doing and this is public, so I can talk a little bit about it, but not too much. But they're doing experiments in the psychology realm called CHAPIA. Have you heard of that?
Yeah.
So CHAPIA is a year-long practice run for a trip to Mars and seeing how um, that goes. And so there's a lot of ethical debates on how close to a mission to Mars can you make it without compromising safety and mental health and things like that.
So
Um,
like pulling the chute on the whole thing, say, hey, this
right,
is getting out of hand. The team dynamics
exactly.
are spiraling out. When to
Yep.
pull, when to hit the eject button.
Exactly. So, like, if teammates start arguing, that's not too bad. But if they start getting physical, that's pretty bad. And um, when do you draw the line of, hey, this experiment's over?
Hmm.
And then also, do you delay the communications like you would have on a trip to Mars? And then what happens if there's an emergency? Um, uh, can you not delay the communications then? Do you record everything? Do you record their private psychological conferences? Do you record their private medical conferences? These are all kind of ethical issues that the psychologists are tackling in trying to prepare as best we can, like you said, prophylactically, for a deep space mission to Mars. But it's
I,
challenging.
Yeah, I actually hadn't even considered that. As much as I like dove into this field and tried to learn as much as I can, which is why we're here on the podcast, just trying to learn as much as I can about this field and all the different questions that kind of come up. So yeah, like the question of we really want a high fidelity mission that we can simulate, and we want it to be as high fidelity as possible and in the same breath say, well, now someone committed a crime, or now someone's
Yeah,
health is on the line,
right.
um, for what the stakes are, high if you're going to throw out a 1 year mission and everything
Right.
else, all of that effort that went into it is now
Yeah,
gone,
right.
and
And
then
money.
yeah, and money,
Money's
um,
a big part of it.
yeah, and
Uh,
it's that's just I actually hadn't considered that. It must have there must have been, it must happen. I just had never thought of it.
yeah. Well, they already did one. They already did one CHAPIA mission for a year, and it was successful. but these kind of questions pop up of, um, what if someone shuts down and isn't doing their tasks? Do you but they aren't saying anything. They aren't saying, you know, that they're depressed or anything, but they're just done with it, you know.
Yeah.
But they probably have a financial incentive to complete it. There's all different kind of ethical boundaries that you have to establish.
Yeah, I mean, when you even brought up the cameras, like the recorded private medical conferences, you'd want to inform and disclose that you're recording these things beforehand.
Right.
And if you don't, then that's problematic. And if you do, that's
Right.
also means your data kind of moves your
Right.
data
Right.
threshold or your
Yeah. It's
quality
like
down a little bit.
it's like Schrodinger's box. If you record it, it changes.
Yeah.
Or,
I wonder if they're
if
telling
you
you
look
all
at it,
this. Yeah.
yeah, if you look at it,
Uh,
then it changes the results because people may not be as forthcoming if it's recorded. But there's different opportunities though in that regards. Like, you can use AI, you can have it recorded, or you can use AI to kind of scan things for concerning things. So there's opportunities to use new advancing technology as well, and make it
yeah.
more secure and private.
So do you hear that, all budding psychiatrists and psychologists out there? There's a lot of work to do both now and in the future. There's only going to be more work. One of the things that I kind of come across is, high school students, med students that say, "Hey, I'm really interested. How do I become a part of this?" And it's like, well, there's a lot of there's so much need for good people to be doing all of this work. You just got to go through residency. You got to like start talking to people, start getting involved in the ways that you can, and just keep the torch lit and do the clerkship.
Yeah. Yeah, definitely. It's a small community. Um, what's interesting is when I came back, there was an uh, you know, this last Wednesday I got an email saying there is a lieutenant colonel psychologist in the Air Force who's going to give a talk next week, and inviting all the psychiatrists to join. And I was like, wow, like what a coincidence. I just got back from aerospace medicine clerkship, and now there's going to be another talk. Like, it's a small world that, it's always relevant, and they're always looking for good people to, work through it. Ways to stay involved or get involved. Like if you're in medicine, is asthma. Um, it's pretty, affordable as a med student. It gets a little more expensive as a resident, and then it gets even more expensive as an attending. And then there's a conference every year, and this year it's in Atlanta. Um, I unfortunately won't be able to go to it because I'll be
Oh,
PCSing to
come on,
Virginia.
man.
I know, right? Yeah. I wish I could, but, I have to wrap things up here. I got patients here, and then, I have to, start the moving process to Virginia, pretty soon, coming up, a couple
Yeah,
of months.
I'm sorry to hear that, but patients come first and moving and you have, a whole life, so moving that and it makes sense. I'll be sad to have missed you, but happy to connect here and now for a brief little bit.
Yeah,
So
I'll be at the next one.
yeah,
Next
yeah.
one's in Denver, I think, next year.
Okay, cool. Awesome.
Yeah.
Yeah, I lived in Chicago last year for that one, and now I moved to Atlanta. So now I have to move to Denver, I think is the next step for me.
It's following you around. Or maybe you've got some backdoor channels and you're like, hey, put it in Atlanta this year. I'm right here. And hey,
Yeah.
put it in Chicago.
Yeah, those are conversations you know, not privy to. And honestly, event planning for the whole conference is not my bag. I'd rather just do some science, have some fun, and
Yeah.
not sweat all of the organizational stuff at this point.
Yeah. Yeah. I'm curious kind of what you're kind of doing in Atlanta. I know you work with the Falcons, but I don't know if you probably already talked about it a lot, but what's life like in Atlanta?
It's pretty good. So this podcast is mainly about you.
I know, I know, I
I'll
know.
speak to a little bit about it. So I moved to Atlanta area almost a year ago, and I work at the Emory Sports Performance and Research Center. located in Flowery Branch, which is right where the Atlanta training facility is. And essentially, over time, their athletes would require medical care. And so essentially what would happen is they used to, essentially ship the docs, the physical trainers, all of the staff up there, because you need a lot of space for a whole, training facility. So it's cheaper. So they ended up just kind of building, a small clinic, and then it got bigger and bigger and bigger. And then it kind of brings us to today, where there's a multidisciplinary research, orthopedic clinic, physical therapy gym, and biomechanics lab that I
Oh,
work
wow.
in. So
Yeah.
and we have our own freestanding research only MRI, which is something that I do a lot of work on.
You got a lot of fun toys to play with over there, huh?
Yeah, exactly. So
Nice.
we see lots of athletes that come through our facility. I do a lot of orthopedic work on ACL reconstruction with quad tendon autografts. And then my side job is to work with NASA and talk about spine health in space with Dr. Schuring, and then bone health with Dr. Gene Sabonga. So
Yeah.
luckily was able to kind of keep some of those connections alive after the clerkship, and
Yeah.
they're more than happy to accept some of my efforts.
Yeah, yeah, definitely. And he get and Dr. Anderson gave us a lecture too. So see, this is the thing about mental health is it's about connections. That's why I wanted to know about you and hear more about
Yeah, well,
it.
I appreciate it. Yeah, I mean, I this is why I do the podcast, is everyone that makes their way through med school, through to residency at some point, and then gets involved in space medicine, at whatever level, just interested versus, an actual NASA flight doc. Everyone is, we're birds of a feather. We have something in common, and we all have this unique interest that kind of all binds us together. However, there's not really a good community of education, of um, a platform that really brings all of the people that are interested from all across the world, because asthma, while it's amazing, is a US focused conference that has, money involved, and some people, they're interested, but they, don't come from any money. They are trying to figure out how to get involved and become interested. And this podcast is, free to join, or, the community on Discord is free. And we're
Yeah,
just trying to bring, all these people in from all these different areas. And,
yeah, yeah,
we have the technology, we have Zoom, we have Discord. These are all free things. Why do we have to
yeah,
gatekeep it? And it's kind of break down some barriers.
yeah. Definitely spread the word. Yeah. That's the thing about space in general. I went to a lecture in undergrad by Neil deGrasse Tyson, which was really cool. I saw him in person, and I talked with him a little bit. He kind of made fun of me, which is kind of his attitude, which I heard a lot. But that's kind of what he does. Um, but he said, we could send 10 times the amount of drones to all different planets and explore a lot more stuff if we didn't have the human element to it. We could, go to, the moons of Jupiter. We could go to Mars, send a lot more drones if we just put all our money on that. But that doesn't bring in the human element. That doesn't inspire the nation to get behind it. Behind something so big as to send a human. We can all feel proud and accomplish when we send a human to the moon. And then we stop being, different political parties, different countries. We all become human because when you look back on the earth, it's all one species of humans. You can't tell political lines, you can't tell country lines, you can't tell any of that. It inspires a nation. Like when you put someone on the moon, you inspire little boys and little girls to say, "Hey, I want to do that one year," or "I want to help do that." I want to do better in my science classes. I want to become an engineer. I want to, make those good grades, get the engineering degree, and eventually maybe work at NASA, or maybe even just, get inspired to work in the civilian sector and invent something that NASA could use. Um, yeah, there's
Or go to
all
space
different
camp.
types of ways. Yeah, space camp. There's all different types of ways that putting humans first and foremost in space exploration helps not only the country but also like the world to inspire people. I strongly believe that, and the human element and the mental health element is kind of what my passion is, but it's all kind of linked in my view.
Absolutely. Yeah. I mean, um, I did like a MD and a PhD, and the only thing that got me through the PhD was the tiny sliver hope that one day that this would be useful to moving the needle on helping people live on the moon and Mars.
Yep.
And like in my dissertation, like on I think it was like the acknowledgments. I was just like I thanked SpaceX, and I was like, thanks for you were engineered quickly, you iterated, and all of these defining features. You guys pushed the boundaries, so you guys were my guiding light, and that's
Yep.
that's the literally the only thing besides my girlfriend at the time
Yeah. Yeah.
that got
Yeah.
me through that. And yeah, I mean the inspirational component of it
Yeah.
cannot be undersold. Cannot be.
Right. Yeah. So a biggest thing is in mental health is hope, and having something at the a light at the end of the tunnel. And not talking about the death light when you're dying and
Yeah.
you see the light at the end of the tunnel. A different light at the end of the tunnel that keeps you grinding in the day to day. Residency is tough. I feel a little jaded, a little worn out, a little burnout, from residency. But the light at the end of the tunnel is exactly what you talk about, is potentially being able to work with astronauts. This clerkship reignited my passion. And just keeping that hope of maybe one day being able to help, astronauts, space travel, even nothing to do with space, even helping airmen, pilots, people who serve the country, even just everyday people, not in the military, civilians with their mental health, get keeps a light at the end of the tunnel, makes the days less grindy, even though sometimes you just got to grind. But it keeps you going. Having hope is a big positive influence on anyone's mental health, and to inspire them to keep doing what they need to do
Yeah. I mean, if I could, bottle that up and just, put it on a space capsule, or I
and
could
sell
use
it.
it. I could use it here at home, where I just go in the fridge and open up a little
Yeah,
can of hope, and
take a sip of hope.
yeah.
This is Michael Jordan special stuff.
Yeah, I definitely find when I yeah, I mean, it's almost a tautology. Like, when I'm in despair, when I'm directionless, um, I'm always like, I need that hope again. And obviously that, makes sense. When you're hopeless, you don't have hope. But yeah, reformatting your life to kind of towards that goal. The goal can change. I sound like, a parent right now, or my dad or whatever. But always having
Yeah.
that goal ahead of you to keep you going is so important.
Yeah. Having a light at the end of the tunnel, and yeah, it can always change. It can always adapt.
And it will
I thought
adapt.
yeah, it will. Yeah, it will definitely adapt. I thought I was going to do a medicine year and then flight doc for a couple years, and that changed. I was like, I'm already 1 year into residency. Let me just get it all the way over with. I don't want to have to go out and work as a flight doc and then come back to residency and then finish residency at an even later age. Um, and yeah, so that changed on me. And the other thing is you will fail. You will fail many times in your life. I've failed many times. I took the SAT 3 times because I got a 1570, a 15 or no, a 1370, 1390, and you had to get above a 1400 out of 1600 to get to the honors program. So the third time I got a 1410. to get to the honors program at University of Florida. And I took the MCAT twice. First time I got, like a 502, and that was enough to get me two interviews. And then I took it in the middle of the application cycle and got a 512. So when the interviews came up, I was able to talk about how I improved, and what I did and what I learned from that and stuff like that. Um, I yeah, I've failed numerous times, applying to PhD programs. That's why I applied right out of undergrad, didn't get into any, and that's why I did the master's program in mental health counseling. You never know what your life will come about and change and what path it will lead you on. But ultimately, it is what it is, and you make the best of it what you can, and then you keep your long-term goals in mind, and then you keep working towards them.
Yeah, I mean, yeah, I mean, wow, great life advice. Yeah, I
Yeah,
think one of the things recently that's kind of helped me is, imagine a life with no problems and your entire trajectory, all the, your whatever you want, you could just have, magically have. No problems, no friction, no nothing. It'd
yeah.
be kind of a bad life, to be
Sounds
honest.
boring,
It's kind
right?
of
Yeah,
boring.
yeah,
I found the times that I really cherish the most have usually during them are some of the hardest and most stressful. But when you look back on them, you're like, holy smokes, like that was what a time. What a time that was.
yeah, yeah. There's a book called The Power of Positive Thinking. It was written by a guy, I think is it begins with a V, Vaughn or something like that. And it was written in like the 1950s or 60s, and basically the premise of it is the power of positive thinking is that whether you think that you will succeed or you think that you will fail, you will be right. So you should think positively and that you succeed. Most of the time, it is more likely that you will be right if you think positively about succeeding. Trying to put a positive energy out there, and inspiring yourself to do better. If you start to think negatively and that you can't do it, then that's when you won't be able to do it. So it's kind of a self-fulfilling prophecy in that sense.
Yeah, I mean, even starting this podcast, I was like, oh man, I'm gonna like put myself out there. It's gonna be so risky and um, how is it going to go? What are they going to think about? I'm not an expert in space medicine. I have
Yeah.
my unique angle. I have certain things, certain people I can talk to about it. But I, don't consider myself an expert by any means. But I get to talk to a person like yourself and all the other people I've had on the show and begin to kind of learn more and more about it and make friends, build connections, and that's the whole thing. And it's been a journey that I started in 2020 out of frustration that I couldn't be involved in space medicine, but I had all of this emotion about it, and I wanted to do something that could bring other people along for the ride, and it's only turned out for the better. And yeah, I mean, but it did take some effort to be like, okay, this could be really bad idea. But here we
Yeah.
go. Let's take the risk and go.
Yeah. Yeah, definitely. And that's also what life is about, is taking risks. You shouldn't be, loose cannon. Well, maybe some people are, and they're happy with that and taking all these risks whatsoever. But it shouldn't be, so like there's a saying that ships are safe in harbors, but that's not what ships are for. You shouldn't constrain yourself, and stay at home and you know be satisfied. It's about moderation, and everybody is different on their tolerance level for taking risk and whatnot. Some people are very happy, with a little bit of risks and living that 9 to 5, and having a happy family and things like that. Some people want more excitements and change a job every year or every month, and they can't sit still. But that's kind of the beauty of the spectrum of humanity is how different we all are, and then how also connected we and same and similar we all are.
Yeah, it kind of reminds me of something you brought up earlier. You kind of you didn't name it, but you kind of brought up the astronaut perspective, looking back on Earth, because almost every astronaut you talk to or you hear their interviews or however you hear it, the first thing you do is you look back at Earth. Like you just
Yeah.
left, but you constantly enamored by this vision. You have the landscape unfolding on the horizon before you. And then you talked about like the borderlessness, you talked about the connection. So there's a term for this called the overview effect, where there's a book written about this coined term. And I was curious, like, have you thought about this anymore? Is it is it a useful term? Is it, what do you think about it?
Yeah, I think it's definitely useful. It reminds me of during the aerospace medicine clerkship, we had a lecture by Mike Barrett, former astronaut and former or current physician.
I think
He
he's a
was a
current
flight surgeon.
astronaut. He just got back from a mission. Is he still on service or did he retire recently?
So during his lecture, actually, I don't know. I think he's still on service.
Okay.
Yeah, I'm not sure how much I can speak to it, but so yeah, so he talked about how his different experiences, going up in the shuttle, he did Soyuz, going up to ISS, and the first time you it's quite a ride in the shuttle, and it's there's a lot of G's on you, you're strapped in, and then you get up and then suddenly you fall forward in your chair and you're weightless, and then you see the earth, and it's like wow, it's like that, and then you start to feel like a little nauseous and like tingly because you're in space, and it's kind of like just a giant, you know, overwhelming experience, that he loved. And then when he started to go up on other missions, he would watch other people instead of, same experience for him, but he would watch other people experience it and just see the look on their face and how they're experiencing it. And that was kind of a cool experience for him to now being able to see other people do it for the first time. So it's yeah, I think it's kind of has to do with that overview effect and how everything is kind of related and taking in the big picture of things, which I think is one of the biggest things in space travel is it makes us keep in mind the big picture of things a lot of times.
Yeah, I've thought about space medicine, psychiatry, as someone interested in the field in general, and it feels like space medicine psychiatry is kind of a tale of two worlds where you have this kind of overview effect, this kind of transformative experience. And then at the same time, you have astronauts that are essentially bored, or they like they essentially have so much they're overworked and they don't have enough time, like personal time. They feel micromanaged, and then they have a lot of waiting between certain
Hmm.
things. It's kind of like the hurry up and wait type of thing.
Yep.
So it kind of feels like it's two sides of the same coin, but they couldn't be more different. And so kind of mixing those two is kind of a really interesting thing that I'm sure the military has a very similar thing too.
Yeah, exactly. That's a common saying in the military is hurry up and wait. And the astronaut schedule, I don't know if your listeners are aware of this, but it's like their schedule's down to the 5 minute mark. Like they have tests like scheduled, in blocks, but they have every 5 minute block, marked. Um, and so they're busy people. Sometimes they're overworked, and part of our job in the medical field and flight surgeons, and especially mental health, is advocating for them. because a lot of times they won't advocate for themselves. Um, and we see a lot of that similar thing in the military field as I do have to call command a lot of time of soldiers because they won't advocate for themselves. Um, like I had a guy who was having really bad sciatica pain, and his command was getting on him for going to doctor's appointments. So I had to talk with command that he needs to go to his doctor's appointments and things like that. It's the same thing with astronauts. Um, and advocating for them because a lot of times they don't complain a whole lot because as we talked about in the selection process you kind of select out for people that are not or that are negative or that are complaining or things like that.
Yeah, it kind of goes to some of the things I've heard about, like aviation medicine for commercial airliners, where you have pilots that don't want to disclose certain things because they're worried that their wings will be taken away. And
Hmm.
then talk about, your astronaut wings being taken away.
Yeah.
Just kind of the ability to um, hopefully like unlock some of that privacy to get to a better place where you can take care of them,
Right.
is probably an incredibly is it's such a large barrier. I mean, do you have any like insights into, ways that you've been able to, avail some of those things in your airmen?
Yeah. So to first of all, you have to not seem like a big giant member of the bureaucracy that they have to navigate through and that they have to hide stuff from or that they have to, do all this work to if they're going to be truthful. You have to connect with them on a personal level. And that's the key in any kind of mental health field is connection. Um, and if you connect with them, you get to know them, what's their motivators, if they're married, if they have kids, what they like to do. Um, then you can kind of tailor what their treatment plan to that. And also you can kind of understand where they're coming from, when they're struggling and they're not performing as best they can for the mission. Because the ultimate goal is to get everybody at the highest performance level to complete their mission, whether that's cybersecurity, that's security forces, logistics. There's all sorts of fields in the Air Force. Um, and then, helping people get to a functional level where they're able to complete their mission. Just as an example, like you get military, doesn't it runs 24/7. So there's people on night shifts, like cybersecurity night shifts, there's security forces night shifts, things like that. And if I have a patient that, has a young kid and then he's having to switch to nights and days often, like switching every month, then, I can talk to command and be like, hey, he just had a young kid. Um, he's already losing sleep from that. He's going to lose more sleep if he's not if he's switching days and month or from days to nights every month. And it wouldn't be that good if he was on that track to switch for at least the year or so that his child is that small. Like, could we just keep him on days or just keep him on nights so that way he's not losing more sleep and is not as functional and not as good of an airman, and that would hurt the mission. So if you kind of explain it that way, then you can kind of get everybody on board.
Yeah, it probably takes a long visit to get there, at least from an initial visit, because
Oh
establishing
yeah.
that trust and um, all of that extra context that you just laid out, it probably takes a long time.
Yeah. Yeah. Yeah, exactly. They say, it takes at least, 2 3 visits to really form a what we call a therapeutic relationship, and really kind of make that bond between whether it's a therapist or a psychiatrist or psychologist and the patient.
And is that do you feel like that's like consistent across, anyone's background? Like have you noticed like, oh, it takes longer for my airmen or oh, it takes less for any extra context on that?
Um, it it does take longer sometimes. It does go quicker sometimes. I'm a big sports fan and I'm a big NFL fan, so I find if someone is a NFL fan or sports fan and I can talk to them about sports a little bit, I can make a connection a little bit quicker and they can kind of understand that I'm on their side to, help them. But it varies person to person. Yeah, it you know all I see all sorts of different people, and sometimes it's kind of a fun challenge to find a way for me to connect to them. But usually, usually I'm able to.
Yeah, I'm sure that yeah, I can relate to that, trying to unlock certain people and make people feel comfortable is such a fun thing to do. Even if the you start out kind of a little more at odds with each other, and then getting to a place where you've come away and things are good is such a great feeling. And you get to practice that day in, day out. So I'm sure you're very good at that.
Yeah, yeah, definitely. And sometimes it's harder. Sometimes, like, psychiatry, sometimes you get people coming in demanding controlled substances, demanding a stimulant, demanding a benzo, demanding things like that. And a lot of times, you kind of have to redirect that energy a little bit, but sometimes people are so, demanding about that kind of stuff that it gets difficult. But what you don't want it to become is adversarial. Sometimes you just have to say, sorry, I can't do that for, this reason. But here's, some ways I can help you.
Yeah, that's got to be, some of the most, those boundaries that you set between you and your patient, very important to keep. And yeah, I mean, it's the unique and interesting position that psychiatrists find themselves in. So
Yeah, yeah,
that's great.
yeah. That's why I think the clerkship was also a really good thing for me personally, is because it was a little bit of time away from residency. Residency's a grind, and it was a time to get away residency. I almost felt like I was back in med school, because there's a few lectures every day. They're about 2 hours each. 1 to 3 lectures every day. They're about a couple hours each. It was like cool version of med school, and there was no test at the end. So, you got to learn because you wanted to learn. It's not because you were going to be tested
Spoiler
on it.
alert. Oh man, you just like let the cat out of the bag.
Well, there's
All
not a
these new
test.
clerks are going to come in and know this is not a test, and you just ruined it all, man.
Sorry about that. There's not a test, but there is a poster presentation at the end, so you do have to work on that. So that is kind of the end of the clerkship experience. But it was fun. We had a good crew. Amy, who, if your listeners don't know, is the liaison for the aerospace medicine clerk. She's amazing. I love her to death. She was just an awesome person. We had we had a very social group. If you weren't aware, I know you went skydiving with us. But like it was interesting because she sent out an email saying, "Hey, um, if you guys want to share numbers and things like that, to get to know each other or start a group me, just start talking to each other." Then a lot of clerks have done that in the past. So I was like, all right, I'll start it off. And I put in my number and said, hey, anybody want to start a group me or things like that? And then I heard nothing for a couple days. And then someone started the group me. Brooke started the group me, and and then I sent they said, "Hey, this is a group me for aerospace medicine clerks." And then I sent a message, "Hey, does anyone want to room together? Have a roommate for the month. Split costs and things like that." And I heard nothing like a week for a couple
You're
of
like, what
weeks.
is it? Do I smell through the
Yeah,
phone? Do I look, is I
yeah.
look funny or what's going
No,
on?
I was just like, all right, I guess this is just an antisocial group. Maybe I'll just drive home to
Yeah,
San
you're like,
Antonio each weekend uh and do that because I don't think they're gonna hang out much. And it was like the complete opposite. We were hanging out, almost every night, probably like 6 nights a week. We rented an Airbnb at the end. Um, had a good time. Um, we went skydiving together. One girl in the group, Elizabeth, was really big into skydiving. She's gone like over 50 jumps. She was licensed. And so she said there was a good skydiving place. And so we all went to Spaceland skydiving. I didn't go the first time because I was, doing some things, but I went the second time because a few people went back. And that was a blast. It was a good conclusion to the clerkship. Um, yeah, we had a good time. Uh, we would go to Run Club every Tuesday, and then one week we did trivia, we did karaoke, we did all you can eat sushi twice. um,
This just sounds to
we
me
had a
like
good time.
this is your therapy. These are your love languages. These are
Yeah,
all the things that help reset you from the demands of residency. And
yeah,
yeah, I can definitely
that's a
relate.
good
Yeah,
way to put it.
yeah.
That's a good way to put it. It's my therapy, and it was a way to get me back grounded again, away from kind of the grind of residency. Because we found out that we got the clerkship in late January, so I had to kind of move my call shifts and move a lot of my patients to before and after the clerkship. So I was really busy, the week before or really the month before, doing extra call shifts and seeing a lot more patients. And then the week after, I was seeing a lot more patients this last week. So it's a good kind of way to get, you know, out of that grind and out of the humdrum of residency a little bit.
So we are rapidly approaching our orbit. 90 minutes is the time it takes the International Space Station to go around the Earth.
Yeah.
So we're currently recording about an hour, 10 minutes. So I kind of wanted to shift into, where you're going next and what are your plans for the field? Like, what kind of impacts do you hope to make on the field going forward? What kind of
Yeah.
papers and fun things can
Yeah.
we expect from you in the future?
Yeah, definitely. So I am currently going to Langley Air Force Base in June. Um, and then I'm there for 4 years. Hopefully I can do flight medicine a couple of years and then hopefully do the residency in airspace medicine after that. In the near future, uh, we with my mentor, Dr. Williams, and I had a partner for my poster presentation, um, Dr. Judy Mizrahi. She was an awesome partner. She had a lot of energy. She had a lot of ideas. We were able to put forth like a really cool poster. We did the interactions of psychiatric medications and all the other medications on the ISS for flight surgeons to be aware of for side effects and basically the interactions if they're taking more than one of those medications. And so what we're planning on doing is getting that kind of um, like finalized and things like that, and so that it can become a research paper and that we can kind of present it at ASMA next year because the next one is coming up quickly in June. So we're going to work with Dr. Williams on that. He was excited about our poster. He's going to talk with behavioral health about possibly getting it, into like a digital format, the interactions, and maybe expanding it into other medications so that flight surgeons can use it if they're prescribing different medications for astronauts. So we're going to work with him on that. And then one of our other co-residents, Kinnery, was working with him as well on uh, TEMS, and how that can help in space, which is trans electrical magnetic stimulation, to help with some of the vestibular problems that astronauts experience when they get back. And also in deep space missions, some of the vestibular problems are going to be even more to a forefront because you won't have physical therapists on Mars to help you, get up and walk around. So a lot of that stuff will need to be rehabilitated, with machines or on your own, and they'll have to find different ways to do that. So yeah, we're all working on different kind of research things to potentially present in the future at ASMA, and help out NASA that way. Hopefully, I'll be part of the team like Dr. Gary Bevan is a NASA psychiatrist, and he works with behavioral health team on all different factors involved in space, whether it be the selection of astronaut candidates or uh, informing flight surgeons for behavioral health things, medications, things like that for astronauts. So hopefully in the future, I'll, I can maybe do that with him, or if he's gone, then maybe I'll become the new Dr. Gary Bevan.
Well, that would be amazing. I mean, you're setting yourself out, getting all those relevant experiences, having the psychiatry background, then also hopefully doing the Air Force RAM, and then combining the two. That's like a beautiful equation. I think NASA would more be thrilled to have a person like you in the future. And yeah, I mean that behavioral health team at NASA is only like a handful of people, it feels
Right.
like. I mean, I don't know everyone by any means. Um, but yeah, I mean, I think there's so much work to be done, and having someone with your background would be amazing.
Yeah, the team is bigger than a few people. There's a couple more people that I met that were part of the team. They were in the middle of astronaut selection candidacy. Um, so they were, understandably pretty busy. And they were in their kind of forward operating base in the field to kind of work with that work on the astronaut selection. I can't talk too much about that, but it was kind of cool to just be be there, even if they wouldn't let me participate at all, which is understandable. Obviously, they want to keep that kind of stuff under wraps.
Yeah, I mean, I think even seeing some of the things and knowing some of the players in the room, is the way to figuring out how to get yourself involved. And so I think, all the things that you're doing the clerkship, I think you're well on your way to figuring it all out, and treading this path that we all kind of want to figure our way out, but there's no real pipeline. Like medical school,
Yeah,
there's many, many, ways to and look up how to get into med school. Very, very defined path.
yep.
But how to get involved in space medicine, not so clear. So
Yeah. Yeah, I didn't even know that there is a clerkship at Cape Canaveral as well. And apparently they offer it like at all months of the year. Um, so that's pretty cool. I wish I had known that when I was in med school in Orlando. But I don't know if my school would even let me go because of COVID. Um, but yeah, there's all different clerkships, and there's courses, there's online courses that uh, I know Johnson Space Center puts out, things like that to get involved as well.
yeah, I think it goes to show that, you know, the most the most clear role for how an astronaut's health is managed is the NASA flight surgeon who's sitting on console, who's in mission control, who's picking them up after they come out of a Dragon capsule or a Soyuz capsule, and who's watching them launch. So those are the most high profile positions that I can imagine. But what we're describing here is all the other support roles that go into astronaut health. And there's many other different types of roles from research to other clinical specialties that all kind of relate to astronaut health, and they all interface with flight surgery. So that that project you mentioned, hopefully one day will be, in some pocketbook or in the flight manual or something like that for them to use. So it kind of goes to show that there's many different ways to get involved, and there are some more well-defined ways, and there's some very, very obscure ways. And we're all here to, I'm here to cheer you on in your journey, and to say I think you're doing, cool and awesome work, and want to see, and can't wait to see where you go with all of your awesome background and work.
Yeah, yeah, I'm excited. Yeah, I didn't realize how many roles there were because some of the best parts of the clerkship are the tours we go on. And we tour like the nutrition lab. There's food scientists, calculating how long things will stay good in space and how to freeze dry stuff to make it taste good, how to get so they don't have a bacteria in it and still taste good and all that stuff and still stay good for, uh, you know, however many months or years. Then we saw like the moon rock people, which I didn't even know was at spot Johnson Space Center, and that's like a sterile lab where people are wearing these white bunny coats to make sure that they don't break the sterile field of the moon rocks that they got from the moon landings that were like 50 years ago, and they're still doing analysis on them, and they actually preserve some moon rocks to wait for advances in technology to analyze them, which I thought was really amazing. Like they're able to CT some of the moon rocks now, when CT wasn't even invented when we landed on the moon. Um,
Oh my God,
yeah, so there's
that's yeah, that's incredible.
Yeah, so there's a lot of different people like that. The guy we talked to had a PhD in geology, and he was working with NASA. So there's a lot of different people and a lot of different ways to get involved. A lot of the coolest parts, the coolest tours were like seeing the suits, the Argo suit, which is the suit they're going to wear for the moon missions when they go out on the moon, and seeing the engineers work with that, and seeing the astronauts, pick up balls on the ground or get up from prone position in the suit, and seeing how they, tailor that and make it so that it's comfortable for the astronaut and able to function well. So, all different ways to get involved. There's a lot of cool jobs.
Yeah, unfortunately, not really hiring right now, but
Oh, yeah. Well, I don't know that. I don't know who's hiring or whatnot, but just keep uh doing the best job you can. And if you do, an excellent job, and you're kind of known in the field or you're close by, even sometimes proximity plays a factor, NASA uh can hire you, in the future.
yeah, it's funny you mentioned that. When I was down there for that week, I was a part of a technical interchange meeting with all of the spine and MSK people. And essentially, some of them, I'm sure they were involved previously, but a lot of them come from Texas Medical Center in Houston, which is, depending on traffic, that's one of the closest places you can go. So just being the person that, the flight surgeon wants to call, and you have a good relationship with them, is goes a long way, more than I ever
Yeah.
would have expected.
Yeah, definitely. It was interesting to see how many people were backgrounds were from universities, in or around Houston. So it shows they draw on kind of local universities and things for a lot of their stuff. So yeah, but they also
So
take people from all over.
yeah,
They also
exactly.
take
Yeah.
people from Stanford and from Navy and San Diego. We had people from clerkship from backgrounds of all over in the clerkship. So it's you're not limited. Um,
Yeah,
yeah.
you begin to as you get more and more in this field, you begin to have friends from all over the place, and it's hard to keep them all together. So having an online kind of thing is more and more important.
Yeah, for sure, for sure.
So
Yep.
kind of
And
some wrap up
yep.
types of things. What's your favorite like space medicine, psychiatry like uh, issue, or like is it isolation, confinement? Like is it what are some of the aspects that's like your favorite thing? And then what was something that was unexpected that you learned during the clerkship? And then we can kind of wrap from there.
Yeah. My favorite thing is the teamwork dynamics. I'm an officer in the Air Force, and I had to do commission officer training school. In Tuscaloosa, or no, in at Maxwell Air Force Base in Alabama. Alabama. Um, and my favorite thing during, boot camp obviously isn't the most fun thing, but my favorite thing at the end of boot camp was the teamwork activities and overcoming obstacles. And you get a chance to be a leader of your team, and you get the chance to also be a follower. And, there's different dynamics involved. And it's cool to see the same things kind of applied for astronauts. And I think that is a cool, interesting new uh, upcoming challenges of how that's going to play a factor, in the Artemis, even just recent and uh, uh, very close upcoming challenges like Artemis 2, is the size of a Volkswagen Beetle, and you're in there with four astronauts are in there. Um, and so you have to maneuver around and work as a team for 10 days. It's going to be a challenge, and it's interesting to see. And then for deep space, it's a huge challenge in teamwork dynamics and seeing how that will play a factor, and trying to prepare for that. Um, so that's cool to see. And then some of the uh, things that I was surprised about is how many problems in space there are. I knew there was a little bit of a fluid shift, but I didn't know it was that prominent. I had never heard of SANS before I got to the clerkship, which is spaceflight associated neuroocular syndrome. Um, I thought radiation might be a problem. I thought micrometeorites would be a bigger problem than um, what they led on it as. But I was surprised at the number of problems that astronauts face. Um, I didn't realize, that it felt like you have a stuffy nose most of the time if you're on the ISS because of the fluid shift, and all the fluid going to your head. So yeah, it was kind of eye-opening, all the different challenges that the flight surgeons and everyone else at NASA are facing.
Yeah, it's funny how like you begin to realize how everything's connected within that human system. So, like, one of the biggest psychological reprieves that I've heard in astronaut interviews is when they get fresh produce, like oranges. It's like a huge win.
Morale booster.
Yeah, yeah. But like you have these fluid shifts where your venous compartment collapses down, these fluids go cephalically into the sinuses and into the brain and the upper limbs, um, increasing, stuffiness and feelings of congestion that decrease taste. And all of a sudden, this thing that these foods that you used to love maybe tastes more bland, and you're not getting the same type of morale boost that you would get from having fresh produce. So everything's connected, even tangentially. The human system is, especially in space, is all connected.
Yep. And then a lot of that stuff plays a factor, like you said, with behavioral health is like fresh food is like a morale boosting event. And it's all from the fluid shift, like you're eating, freeze dried, basically MREs, meals ready to eat. And it tastes the same. And, they have to, I heard sometimes they do rock, paper, scissors over who has to eat the next meals that they don't want, because they have to eat a certain amount at certain times before it goes bad,
I
before
hadn't
they can
heard
get
that.
to,
That's pretty funny.
yeah, sometimes they rock, paper, scissors to see who has to eat, something that maybe they don't like before they can open up the next container. Um, so it's little things like that that you understand that there are is a human element to all this. And our coordinator, Amy, said it well, is that everybody on the flight deck except biomedical engineer and the flight surgeon, and the biomedical engineer is both, is has to do with the machinery in space, but only the flight surgeon and a little bit of the biomedical engineer have to do with the human in space. And so that's kind of telling us our our important job is to be an advocate for astronauts and things like that.
Yeah, I mean, that just goes to show you, like, there how many positions on console are there? There's like,
Like 12 or so.
yeah, it's like a tenth, or a 20th maybe,
Mhm.
um, of the effort, or of the sitting personnel actively taking care of systems. Only one or two of them is related to the
Designated.
human. So it kind of
Yes.
that kind of
Everyone
paints,
cares about humans,
yeah.
but only a couple are really advocates for the what's going on with the humans.
Yeah, it's a fair point that everyone is there for the mission, which includes the human, but
Mhm.
having a human forward person such as a physician, or a biomedical engineer or a BME, it just and NASA is an engineering place first, and some of the times the human component is kind of left, a
Mhm.
couple steps too far behind. So being an
Yep.
advocate for your astronaut and kind of putting health first as best you can in those rooms is something I've heard quite a bit, and it was always interesting to hear that.
Yeah. Yeah. I thought that was very eye-opening and it was just amazing the all the eye-opening things during the clerkship. It was a very informative month, and I was just astounded on all the different things I got to learn.
Yeah, I'm so happy you were able to do it, and that you had such a good experience. Hopefully, the next person I'll be interviewing will be Amy herself.
Oh wow.
To help advertise it, and we have a small community of listeners. I think we have over 100 members on Discord, various levels of activity. So there's really only probably like 5, 10, 15 people that are really active. But yeah, we have a small group, and I think the more people that learn about the field, the more that we'll get good people to enter it, and it'll just make the pipeline a little bit more robust. And I don't want, you know, there's so many people that I've talked to that hear about space medicine by chance. They have someone, that say, "Oh, I'm interested in this thing," and they're like, "What? What is that thing that you just said?" And then the whole world opens up for them. But there's so many medical students out there that have never heard of this field, so why
Yep.
not kind of advertise it a little bit more?
Yeah, definitely. I think you're doing good work. I think that's awesome to bring awareness to space medicine because I would have loved to know about all the different ways to get involved, and all the different clerkships and all the different research and the asthma and all that stuff. I think you're doing an awesome service to people who just kind of want to find a way to get involved but don't know how.
Well, thank you for coming on a Zoom because that's
Yep,
all I'm doing is hitting record on a Zoom and talking to people who want to talk to me. So, you did the hard work. You told me about your life and your journey and where you want to go. And yeah, so thank you for coming onto the podcast and just taking the time. I super appreciate it. Thank you.
yeah, no problem. Yeah, I'm happy to do it, and I'm just glad that you're spreading the awareness. But definitely tell Amy I said hi, and tell her thank you because I had an excellent time. I can tell her that, but you know,
Yeah.
the more
Um,
she hears it, I think the better.
yeah. You'll come to find that if you had a good time in the clerkship and you did decent work, they'll want you back. So
Yeah,
I'm sure you'll be in the orbit, and I'm sure that you'll be back. And if not, we'll keep each other in our spheres online, and I'm sure our paths will cross.
definitely, definitely. Well, I
And
appreciate you talking with me.
yeah, and we actually have completed our first orbit. So I think I'm just gonna wrap us up here. Thanks so much for coming on to Talk Space Med. And thanks to our listeners for listening to Let's Talk Space Medicine. If you want to continue the discussion and meet more fellow space nerds, be sure to check out at Talk Space Med on Twitter and the Let's Talk Space Medicine server on Discord. Thanks and see you next orbit.